Hospitals are often thought of as the hubs of our healthcare system, but hospital closings are rising, particularly in some communities, rural areas in particular. That's the topic of this week's Healthcare Triage. Special thanks to Austin Frack, from whose Upshot column this episode was adapted. Beyond the potential health consequences for the people living nearby, hospital closings can exact an economic toll and are associated with some states' decisions not to expand Medicaid as part of the Affordable Care Act. Since 2010, nearly 90 rural hospitals have shut their doors. By one estimate, hundreds of other rural hospitals are at risk of doing so. In its June report to Congress, the Medicare Payment Advisory Commission found that of the 67 rural hospitals that closed since 2013, about one-third were more than 20 miles from the next closest hospital. A study published last year in Health Affairs by researchers from the University of Minnesota found that over half of rural counties now lack obstetric services. Another study, published in Health Services Research, showed that such closures increase the distance pregnant women must travel for delivery. And another, published earlier this year in JAMA, found that higher-risk preterm births are more likely in counties without obstetric units. Some hospitals close obstetric units without closing the entire hospital. In July, after the New York Times wrote about the struggles of rural hospitals, some doctors responded by noting that rising malpractice premiums had made it, as one put it, economically infeasible nowadays to practice obstetrics in rural areas. Many other types of specialists tend to cluster around hospitals. When a hospital leaves a community, so can many of those specialists. Care for mental health and substance abuse are among those most likely to be in short supply after rural hospital closures. The closure of trauma centers has also accelerated since 2001 and disproportionately in rural areas, according to a study in Health Affairs. The resulting increased travel time for trauma cases heightens the risk of adverse outcomes, including death. Another study found that greater travel time to hospitals is associated with higher mortality rates for coronary artery bypass graft patients. In many communities, hospitals are among the largest employers. They also draw other businesses to an area, including those within healthcare and others that support it, like laundry and food services or construction. A study in Health Services Research found that when a community loses its only hospital, per capita income falls by about 4%, and the unemployment rate increases by 1.6 percentage points. Not all closures are problematic. Some are in areas with sufficient hospital capacity. Moreover, in many cases, hospitals that close offer relatively poorer quality care than nearby ones that remain open. This forces patients into higher quality facilities and may offset negative effects associated with the additional distance they must travel. Perhaps for this reason, one study published in Health Affairs found no effect of hospital closures on mortality for Medicare patients. Because it focused on older patients, the study may have missed adverse effects on those younger than 65. Nevertheless, the study found that hospital closings were associated with reduced readmission rates, which is regarded as a sign of increased quality. So it seems consolidating services at larger hospitals can help sometimes, not harm patients. Many factors can underlie the financial decision to close a hospital. Rural populations are shrinking, and the trend of hospital mergers and acquisitions can contribute to closures as services are consolidated. Another factor, over the long term, we are using less hospital care as more services are shifted to outpatient settings and as inpatient care is performed more rapidly. In 1960, an average appendectomy required over 6 days in the hospital. Today, 1 to 2 days is the norm. Part of the story is political. The decision by many red states not to take advantage of federal funding to expand Medicaid as part of the Affordable Care Act. Some states cited fiscal concerns for their decisions, but ideological opposition to Obamacare was another factor. In rural areas, lower incomes and higher rates of uninsured people contribute to higher levels of uncompensated hospital care, meaning many people are unable to pay their hospital bills. Uncompensated care became less of a problem in hospitals in states that expanded Medicaid. In a Commonwealth Fund issue brief, researchers from Northwestern Kellogg School of Management found that hospitals in Medicaid expansion states saved $6.2 billion in uncompensated care, with the largest reductions in states with the highest proportion of low-income and uninsured patients. Consistent with these findings, the vast majority of recent hospital closings have been in states that have not expanded Medicaid. In every year since 2011, more hospitals have closed than opened. In 2016, for example, 21 hospitals closed, 15 of them in rural communities. A study in Health Affairs looked at the relationship between Medicaid expansion and hospitals' financial health. Hospitals in non-expansion states took a financial hit and were far more likely to close. In the continuing battle within some states about whether or not to expand Medicaid, hospitals' futures hang in the balance. Hey, do you like the show? Helps if you subscribe to it, and if you like the video right down there. And another good way to help the show, patreon.com, a subscription service that lets you, the viewer, support the show any way you like, even for as little as $1 a month or more. We appreciate whatever you can do. We'd especially like to thank our research associates Joe Sevitz and our Surgeon Admiral Sam. Go to HTMerch.com and get merch for all the people in your life. My book, The Bad Food Bible, another great holiday gift, also on sale in stores.